Today, I'm hoping to ask you about a topic that I think is confusing for a lot of us. It is the topic of nipple confusion. And we hear that kind of passed around a lot. And you are an IBCLC, lactation consultant. So I think you probably know a lot about this. So hopefully you can kind of clear it up, dispel some myths, some misconceptions about nipple confusion, what it is. So here's what I understand. Sometimes what happens is that babies learn to breastfeed, and then maybe parents try to introduce a bottle into the feeding rotation for one reason or another. Maybe that goes well, or maybe the baby rejects it, or if it goes well, then the reverse might happen and the baby does great with the bottle, but then starts to reject the breast. So I imagine there could be, any combination of that stuff. And so why is this? Do babies just really get confused about what they're putting into their mouths? I mean, they don't know what it is, or they forget how to use it, or can't figure out how to use it because this thing is too confusing. I mean, that's what it kind of sounds like to me. Is that what nipple confusion is exactly?
I do feel like that used to be the dialogue that people had, or some worries that people had, was that might happen. But really, babies are incredibly smart, and I don't feel like we give them enough credit. I feel like babies do know, they do know the difference between a breast and a bottle. The breast is warm, it's cozy, whereas, the bottle is just different. But babies can still go back and forth, typically, pretty well. There are just some tips and tricks that I think do help make that a little bit easier.
Okay. So why would a baby develop a preference for a bottle and start rejecting the breast? It's not warm or cozy, right? So
Yeah.
you don't have those benefits of the bottle. So why would a baby start to prefer the bottle?
Yeah. So really, we are not really using the language like of nipple confusion anymore, and we're really just calling it flow preference. So some babies do show a preference for that faster flow. So how we combat that is, well, I should go back and say, like, the bottle is often a lot faster than the breast, just because of the diameter of the hole of the nipple. So that flow rate is going to be a lot faster than the breast. And so some babies will start to develop a preference for that faster flow because babies, again, are super smart. So they're going to work smarter, not harder, right? So if they get to lay there and that milk just comes pouring out of them, it makes sense that they would start to prefer the easier route of that delivery, right? And so really what I feel like happens is babies start to prefer that faster flow. But how we combat that is we do what's called paced bottle feeding. And that's where we're just slower and a lot more intentional with how we give the bottle. So rather than just tipping that bottle upside down and letting it kind of, pour into their throat, we're just going to be a lot more intentional about it. Really keeping that bottle more parallel and letting it a little bit of the milk go into the nipple. Let the baby have a good couple suck swallow rhythms or patterns. And then we kind of take the bottle away, let them breathe for a second. And then when they initiate the suckling, we kind of tip it back up. And this is going to mimic the breast a lot more than just kind of pouring it straight in. And so then typically what happens is when we use that method of feeding, babies go back and forth quite easily.
Okay, so when we don't make it too easy to get the milk out of the bottle, so if the babies kind of have to work to get milk out of a breast, but bottles with a big hole, big opening, and then just tipping it in, they don't have to work hard. So it's an easier feed. So making it a little harder to get the milk out of the bottle is the trick. So using the paced bottle feeding method, which I'm going to link in the article, we have a video for that. And then a smaller opening, like, do you look for a particular kind of nipple that's better than another? Does that matter? For a
Absolutely. So we do encourage that the slow flow or even the preemie bottle nipples really throughout the whole duration of bottle feeds. We don't necessarily want to increase the size as the baby grows. I know that's how it's marketed, that, as baby gets bigger, we want to increase the size of the nipple, but that's just not true for breastfed kiddos. We want to keep it nice and slow, throughout the duration of those breast and bottle feeds.
Okay.
Also, bottle nipples can honestly be pretty unpredictable. So you can buy many of the same size, and the flow rate might be different in all of them. And so that's why it's really important that you're staying consistent with using those paste bottle feeds, and not trusting that just because you have a preemie nipple, that flow rate that's coming out of the bottle is going to be the same. Or consistent even with the same brand and the same size. There's still so much inconsistency. And so it's really important that we, as the parents or providers, are really, again, being consistent with that paste feed, keeping that bottle nice and parallel.
Okay. So just trying to make bottle feeding mimic breastfeeding more, using that paste bottle feeding method, using a smaller opening. And then the baby won't maybe be as likely to develop a preference for that quicker, easier bottle feed. That's okay.
Exactly.
That makes a lot of sense. So what happens if a baby does develop a preference for not your nipple, right? A bottle nipple, or bottle feeding? Is there anything you can do to fix that once it happens?
Yeah, so I think really just kind of backpedaling a little bit. So if we have been doing some of those feeds where maybe we're holding that bottle more upright, and the baby does get used to this faster flow, so then when they come to the breast, they have to work a little bit harder than they're used to. I think our goal would be to send the message to the baby that, hey, no matter what, you're going to have to put in some effort here. And so I always encourage families to really start utilizing those paste bottle feeds as a way to send the message to the baby, like, hey, you're going to have to put in some work either way. So you might as well be skin to skin with me while you're doing it. So I feel like babies do tend to start to prefer the breast again if that does happen. But it's usually, again, it's just that flow preference, because they learn that they don't have to work as hard. So if we send the message to them that you do have to work either way, then they're going to prefer the breast again.
Okay. Is there anything to letting the baby learn to breastfeed for longer or get better at it? Because I know, when they first start breastfeeding, maybe it's a little harder. They're just learning, they're developing the muscles, they're developing the stamina and the endurance to kind of, get a full feeding, but gradually, right? So they work up to it. It's like going to the gym, right? At first, you're only going to do a few reps, and then you do more and more, build on it. So I have heard that breastfeeding is kind of like that for babies, where they develop the strength and the stamina gradually as they grow. So does it make sense to kind of let that happen before introducing a bottle? Is that kind of a preventative measure for the nipple confusion or flow preference problem?
Yeah, so there's a wide variety of reasons that we encourage delayed bottles, but that's definitely one of them. So we usually encourage waiting until about 4 to 6 weeks before the introduction of a bottle. The exceptions to that, of course, are if the baby needs supplementation for any reasons, if there's like a medical indication for the baby to receive a little bit extra, that might be a reason that we would not encourage that. Or, in the event that you have to return to work earlier than that, those would be the exceptions to that. But if you're directly breastfeeding and things are going well, we do encourage waiting until at least 4 to 6 weeks before introducing a bottle, just to help prevent that. Once babies know how to breastfeed really well, they always prefer the breast. And so if we kind of get them going with this good breastfeeding, I feel like once we introduce the bottle, it's just this extra thing that they know. It's like learning how to use, chopsticks and a fork, right? Like once you know how to use chopsticks well, you can always go back and forth.
Okay.
Easily.
Okay. I would imagine that some people might wonder, well, if I wait too long to introduce the bottle, will the baby reject the bottle? And I really need them to take a bottle because I'm going back to work soon. Is it more likely in that case, if you wait longer, that the baby will reject the bottle, or does it kind of even out?
I feel like that 4 to 6 week window is a pretty sweet spot. I do find that it can be sometimes, but not always. Like I think babies just have such evident personalities, like right from birth, right? And so some kiddos, have some strong ideas about things more so than others. And so I feel like most of the time they go back and forth just fine. But if we wait too long for some kiddos, then yeah, it might be a little bit more of a challenge. That's why I do encourage, if you know you're going to go back to work, offering a bottle sometimes between week 4 to 6 is perfect. Even like half an ounce every other day is kind of helping them build up that skill that they're going to need to utilize once you do go back to work.
Okay. It's all really good information, Cassie. Thank you so much.
Mm.
I don't think I have any
Yeah.
further questions.
Oh, perfect.